progesterone symptoms. So let's talk about that today. So are you curious as to whether you have hormonal imbalance? Perhaps you are thinking maybe it might be low progesterone, but you're not sure what the symptoms are. Let's discuss what the symptoms are of low progesterone and what the causes could potentially be as well. So, hello, I am so thrilled to be here. For those of you that don't know me, my name is Michelle Cooke. I'm a period and hormone naturopath. I'm a natural fertility educator and a naturopathic emotional release practitioner. And I run a clinic based in Melbourne, and I see patients both online and face-to-face. The name of my clinical practice is Reproductive Wellness. So I basically help women struggling with their menstrual cycles have easy, pain-free periods, balanced hormones, and emotional well-being. So I'm absolutely thrilled to be here today. So if you have any questions or comments as we go through the live today, please be sure to pop them in the comments box down below. And if you're enjoying the content live with me, just make sure that you hit the likes and the loves, just so that I know that you're enjoying the content. So let's get started. What is progesterone? So progesterone is essentially one of our girly hormones, okay? So it's primarily produced in the ovaries, and it's produced by the corpus luteum, so after ovulation. And what is the corpus luteum? Well, it's actually the sac that's left over after your egg has actually been ovulated. So it's actually contained within that, and then that corpus luteum is what's left over. So the role of that then is to produce progesterone in the luteal phase of the cycle, which is the phase that occurs straight after ovulation. And it's also produced by our adrenal glands. So our adrenal glands are two little cute kidney shaped glands that are situated on top of our kidneys, and they actually help us adapt to stress and give us energy, but also they produce progesterone as well. So progesterone is typically at lower levels at the follicular phase of the cycle, which is typically prior to ovulation, and then it's in higher levels after ovulation or post-ovulation in that luteal phase, because of what I described before, and that corpus luteum secreting progesterone. And the reason why it is in higher levels in that in that luteal phase is because it's preparing for potential pregnancy, whether that's something that you intend or not. Its role is actually to thicken the endometrium, or the lining of the uterus, in preparation for a fertilized egg or ovum to actually embed itself into that nice, juicy, thick lining. So estrogen and progesterone are typically in a delicate balance throughout the cycle, and generally completely throughout as well. So if you have low progesterone, this may arise in estrogen excess or dominance, because in relation to progesterone, estrogen is too much, if that makes sense. So this is known as I mentioned, relative estrogen dominance, and essentially, progesterone will be low as a result of that. So what are the symptoms of low progesterone, and signs as well? So let's discuss them. And you don't have to have every one of these symptoms and signs to have low progesterone. You may only have one or two or a couple, but you certainly don't have to have the whole lot to be deficient in progesterone. So you can be experiencing things like lumpy boobs. So you might notice cystic breasts, where you feel little lumps in your boobs. You could have painful boobs as well, typically prior to your period particularly. There can be premenstrual spotting, so spotting that's taking place prior to your period. There can be sleep issues. There can also be mood issues as well. Remember, progesterone is really, really important in stabilizing your mood. So if it's deficient, it can actually arise in depression and anxiety. You can also be experiencing short menstrual cycles as well, and that's because there's not enough progesterone to actually maintain that luteal phase or that phase after ovulation. So the menstrual cycle will tend to be shorter because it will be a short luteal phase. So there could be irregular periods as well. There can be trouble conceiving. They can be miscarriage as well. This isn't the primary cause of miscarriage, but it can be one of the reasons of miscarriage, can be due to low progesterone levels. Ectopic pregnancy, it can increase the risk of that, so there can be low progesterone there as well. There can be tiredness, there can be headaches before your period, migraines before your period. There can also be bloating prior to your period as well. Heavy periods, and that's mainly if you've got estrogen dominance or estrogen excess that you'll have that type of symptom, and painful periods, but mainly if it's due to estrogen dominance or excess, because remember, if we have a high level of estrogen, you're typically going to present with a lower progesterone, because looking at the two and relative to progesterone, estrogen is too much, okay? There can be hot flushes as well. That can be a sign of low progesterone, and migraines, which I think I've already mentioned, so apologies about that. So what are some conditions that typically have low progesterone? Let's talk about those. So there could be PMS, which is premenstrual syndrome. There can also be PMDD, which is premenstrual dysphoric disorder. There can be fibroids, endometriosis, PCOS, and remember, fibroids and PCOS and endometriosis typically have estrogen dominance or estrogen excess, so commonly that will result in that progesterone deficiency. There can also be other conditions, can be luteal phase defects. So the luteal phase, as I suggested earlier, that occurs post-ovulation, and there can be issues with this phase, okay? So that can arise in fertility issues and miscarriage. Hyperprolactinemia, so hyper means too much, so there's an elevated amount of prolactin, and that can actually arise in low progesterone levels, because prolactin is typically produced by the anterior pituitary gland, which is located in the brain. And one of the causes of sort of high prolactin can actually be due to stress. That's just one of the causes, but that can arise in low progesterone levels. A short luteal phase, because if your luteal phase is shorter, obviously it's shorter because there's not enough progesterone to maintain that luteal phase. So essentially that will arise in, it's due to low progesterone, right? So luteinized unruptured follicle syndrome. So this is when the primary follicle, so that mature follicle, actually fails to release the egg or the ovum 48 hours after ovulation. So that's following the LH or luteinizing hormone peak. So it's not actually happening within that 48 hours. Menopause, that can be another reason. It's not really a condition as such, but it's just another stage of a woman's life. But when you're going through menopause and it's been 12 months since your last period, that's classified as menopause. Progesterone is going to be low because you're no longer ovulating anymore, and that's the primary source of progesterone, isn't it? Because as I discussed, when you ovulate, the corpus luteum, which is a sac left over after ovulation takes place, and it releases that mature egg. That's what's producing that progesterone level for you. So it's going to be at lower levels. But remember, your adrenal glands actually still produce progesterone. So it's not going to be completely null and void, but it is going to be lower than what it would be compared to when you're having your period, because you're at a different stage in your life. Perimenopause. So perimenopause is actually the journey towards menopause. So you're not quite there yet, but cycles are becoming a little bit more irregular. They're not as often, you're not ovulating as much because you're leading into that next phase of your life, into that menopausal phase. So typically progesterone will be lower then because there'll be less frequency of ovulation happening and things like that. So that will result in that for you. Okay, so what are the causes of low progesterone? So there's several, let's discuss them. So there can be a lack of ovulation that's taking place. So we discussed that already. That's pretty obvious if ovulation's not taking place. The corpus luteum story that I was talking about, that's what's needed to produce progesterone, and we need that for healthy progesterone levels. So there will be typically lower in that instance. Stress. So stress is a really big one. So a precursor hormone to progesterone is pregnenolone. Sorry, it's a little bit hard to say. Sorry, I always get tongue-tied with these medical terminology. So that precursor hormone is actually used to make cortisol as well. So what happens is known as the pregnenolone steal. So what will happen is your body will prioritize making cortisol, which is a stress hormone, instead of producing progesterone. So essentially it will be driven away from progesterone production and towards that cortisol production to help you adapt to stress, because your body's trying to protect you from that perceived danger. So very, very important to keep your body alive and away from danger essentially. So this will result in a delay, or it will stop ovulation from happening because it's not an appropriate time to be conceiving. It's not safe to do so, even though the body can't really tell the difference between a danger that's life-threatening or a danger that's, it's causing you to feel stress, like being stuck in peak hour traffic, for example, but the body doesn't know the difference between life endangering or just, general day-to-day stressors that we may be encountering. Low body weight. So your body will think that you're going through starvation and it will freak out, and it will essentially be trying to protect you from that perceived danger. So, and it's not a safe time to reproduce during that time. It's a stressful time for the body if you don't have enough weight there. So it will delay or shut off ovulation, and this will result in lower progesterone levels. Excess exercise, so similar type of reason. This can be quite stressful for the body, and remember, stress delays or stops ovulation, which can result in low progesterone as well. Abnormal follicle or egg development. So obviously if that's not sort of developing properly, we're going to have lower levels of progesterone as a result, because we're not getting that mature follicle, we're not getting that mature egg to be released. So that's an issue. That's not going to result in healthy progesterone levels being produced. Ovulation is really a big deal when it comes to the menstrual cycle, by the way. Another reason could be a low LH surge. So remember that LH, or luteinizing hormone, typically surges around ovulation. So if that's not happening, that can delay or stop ovulation from actually taking place, and again resulting in that low progesterone level as well. low cholesterol levels. We need to remember that cholesterol is a building block for our hormones, and we need that to actually make them. So if you're not consuming enough cholesterol in the diet, and I mean healthy fats, not, nasty, unhealthy saturated fats, we need to be consuming healthy sources to actually make and build our hormones. Really, really important. So if we don't have enough of that, we're not going to be making enough progesterone. And also it can result in luteal phase defects as well, because there's not enough progesterone to maintain that luteal phase as well. So remember that too. Weight gain as well, that can also result in low progesterone levels, and in an imbalance of bacteria in the gut. So this is a big one in terms of hormone balance, and we always need to consider this. And this is mainly because there's no sort of management of estrogen elimination happening. So there's a family of bacteria in the gut known as the estrobolome, and that will actually keep estrogen levels just right. If this is out of balance, then there's no sort of control over that estrogen, and it ends up being reabsorbed back into the body, arising in estrogen dominance or estrogen excess. And remember, when this happens, this can result in low progesterone because estrogen's too much, okay, relative to that progesterone. Constipation, so similar kind of thing. If you're constipated, there's nowhere for that estrogen to go. So again, that's being reabsorbed back into the body, leading to estrogen excess, and arises in low progesterone as well. So how is actually low progesterone diagnosed? Well, typically you can do this through a blood test. So looking at progesterone levels, but making sure that you get it tested at the right time. Time and time again, I see this tested on the wrong day of the menstrual cycle, and it's just very difficult to read. It doesn't give us a good understanding of what those levels are like. So if you have a 28-day cycle, typically you would get it tested on day 21, which is 7 days post-ovulation, which would typically occur around that sort of day 14. But if you've got a longer menstrual cycle, if it's longer than 28 days, you're typically not going to be ovulating on day 14. Therefore, why would you test 7 days after that on day 21? Typically you would be ovulating later on in that cycle because you've got a longer extended menstrual cycle. So usually you would be testing it 7 days post-ovulation, so whenever that is for you in particular. So just remember that, if you don't have a 28-day cycle, you need to remember that it needs to be 7 days post-ovulation for you, Another way it can be tested as well is through salivary hormones as well. So you typically just collect saliva into a little tube, and that's a test tube, and that's sent away to a lab to be analysed to assess your progesterone levels that way. Another way you could kind of sort of gain a bit more of an understanding of whether you may or may not have progesterone deficiency could be from symptoms and signs, but it is kind of good to back it up with those pathology methods, so either blood draw or salivary testing. And salivary testing is typically done through a naturopath. It's more of a functional pathology test. It's not commonly done through the GP. They more would do the blood draw, so a blood test essentially. So can a naturopath actually help with low progesterone? So yes, absolutely. And particularly one that specializes in periods and hormones like myself. So we can look into, why it's actually happening for you. We can look at your test results if you've had any done, or refer you to a GP to get those tests done to see if your progesterone is deficient. And assess sort of why that's happening for you, because it's all very well to say, okay, your progesterone's deficient, but just treating that alone is not quite enough. You need to treat the whole story. You need to see Is your liver function adequate? Is your digestion adequate? Is your bacterial gut balance adequate as well? You know, what else is happening? Are you stressed? Have you got any of those conditions I mentioned earlier, such as PCOS, endometriosis, fibroids, you know, PMS, all those kind of things, because that can also result in low progesterone. You need to treat you know, particularly what's going on for you as an individual, because there's so many different reasons why that low progesterone might be taking place. So treatment-wise, generally, if you were to see a naturopath to help you with the low progesterone, it would be using things like natural medicines, so herbal medicine, nutritional medicine, diet and lifestyle advice as well, because there's lots and lots of things that can support your healthy progesterone production here as well. And it's important not to ignore those, because at the end of the day, you know, natural medicine is fantastic, but if you don't couple that with diet and lifestyle techniques, it's really going to be hard to actually correct those levels. I also use a technique known as naturopathic emotional release, or NER. So that's looking at any underlying emotions or stress in terms of those low progesterone levels. We can also test different organs as well. So we can test the ovaries and see if there's any underlying emotion or stress there. We can look at your pituitary gland in the brain, and all these different, you know, glands and body systems we can look at to see if there's anything there that's actually resulting in hormone imbalance for you as well. So I find that a really nice tool to use alongside the physical natural medicines as well. Yeah, and the treatment aims really would depend upon your presentation. So I'd be looking at nutritional deficiencies as well. You know, are you having enough vitamin C, for example? That's really, really important. Your ovaries need that in abundance to actually be able to ovulate. We need to have enough B6, but also B12 as well. We need to make sure that you've got enough magnesium. We need to make sure that you've got enough zinc as well, which is a primary hormone, primary mineral, not hormone, which is going to help with hormone balance. We really, really do need adequate amounts of zinc, very, very crucial. And, you know, iron as well. We need to have adequate iron in terms of the follicle to be able to mature and develop properly, and therefore for ovulation to take place, which results in healthy progesterone levels, doesn't it? Because then we've got that corpus luteum, which is healthy, that's producing adequate progesterone levels. And I wouldn't suggest, you know, going on supplements such as zinc or iron or things like that without actually having a pathology test done first, because it can actually be toxic if you don't actually need it. So just make sure that, you know, you get those levels checked before you think about going on those, and have it assessed by a naturopath. Get them to look over it for you to make sure that you've got enough of those nutrients. And then, as I mentioned, you know, we'd be looking at hormones in general, not just progesterone, but looking at estrogen as well and testosterone to get the entire picture of what's happening for you and why you might be experiencing low progesterone. You know, we'd be looking at DHEA, we'd be looking at cortisol as well, because remembering that cortisol is a stress hormone and that can delay or stop ovulation, which leads to low progesterone. So we need to be looking at that to see if you're stressed and things like that. We'd be looking at FSH and LH as well, so follicle stimulating hormone and luteinizing hormone, because if these are imbalanced, again, it's going to result in low progesterone levels too. Obviously, we need to look at other glands as well and how they're interacting with your hormones too, and if they're causing an effect there. So we definitely would be looking at your adrenal glands, as I've mentioned too. Really, really important. Gut health as well is really, really important. So just assessing that and seeing if there's any dysbiosis there, if you've got any gut symptoms, and potentially looking at sort of gut testing if that's indicated. So looking at the state of your large bowel, looking to see if there's any bacterial imbalances there that are arising in this hormonal imbalance for you, and if indicated, maybe looking at the small intestine as well, which is a SIBO test. So that's a little bit different to the large bowel test, but that's only if indicated, if you've got particular symptoms to indicate that. And then general pathology as well. So obviously looking at nutrients, seeing if you've got any sort of high glucose or insulin, which cause inflammation, which results in hormonal imbalance. So there's lots and lots of different things that can give us clues as to why you are presenting with those low progesterone symptoms, particularly for you. So if you would like support with low progesterone levels, you're thinking, oh yeah, I think I can actually relate to some of those symptoms, or you think that you've got some sort of hormonal imbalance, you're getting irregular cycles, or there might be, sore boobs before your period, or painful boobs, or lumpy or cystic breasts, or PMS, or any of the things that I've discussed before, I would absolutely love to help you. So I'd like to invite you to a free discovery call. So it's 15 minutes where we can basically get to know each other a bit more and see if we're a good fit for each other. And you can ask any questions prior to actually committing to making a booking. So it's just a nice way for us to see if we're a good fit. So you can actually do that if you're watching on Instagram. There's a link in my bio. If you're watching on Facebook or on YouTube, I'll pop the link down below for you so that you're able to book that discovery call. So remember that all these Instagram and Facebook lives are actually on my website blog. So if you're on Instagram, I've actually popped a link in the bio. If you're watching on Facebook or YouTube, basically just head to my website. So it's reproductivewellness.com.au/blog, and they'll all be there. So I've got the video at the top, and then it's all written text underneath. So if you're a visual learner, it's a nice way to look at it that way. So they're all there. So if you've missed any past ones, just go back and have a look on my website for those ones. I'll just double check if there's any questions before I finish up. Just checking Facebook. If you're a little bit shy as well to ask, that's totally fine. You can send me a PM or a DM, and I'm more than happy to answer that for you later on. Or if you're watching this after the live, just pop the comments down below and I'd love to answer those for you. And I'd like to thank you so very much for watching. I really appreciate you. And FYI, I go live every Wednesday, 6:30 p.m. Australian Eastern Standard Time, talking about periods, menstrual cycles, hormones, and women's health. And if you're watching on my YouTube channel, be sure to like and subscribe. Thank you so much, and I hope you have a wonderful evening. Thank you. Bye.